Here is a case, and I want to see your ideas in the chat, please. We have in this case can come in the 2A exam, where what is the most appropriate related disease which can cause this deformity? What is this deformity? Can you tell me in the chat, please? That's great. Okay. So it is rheumatoid arthritis because this is flat foot, and it is associated with rupture of tibialis posterior tendon, then acute flat foot. This is one of the features of the rheumatoid arthritis. Okay. Because you know that the arch of the foot is supported by tibialis posterior and the spring ligament. And the rheumatoid tibialis posterior is one of the targets involved by rheumatoid arthritis. And so once tibialis posterior gone, acute flat foot is expected. Okay. So when you diagnose any case for arthropathy, you have to manage it in this way. The age and sex, duration of symptoms of the involved joints, because this is very important. Young patient is different from old patient. Young patient, juvenile idiopathic arthritis, old age rheumatoid arthritis, and other differentials. So associated disease, uveitis, urethritis with reactive arthropathy, not rheumatoid. It is reactive arthropathy, and the skin disease in scleroderma. Laboratory values: rheumatoid factor, uric acid, and the markers for the other markers for the tumor, for like ankylosing spondylitis. Okay. So here, how to analyze a case of arthropathy? It is by distribution, the joint space narrowing, the either uniform or non-uniform. Are there joint deformity or not? Is soft tissue swelling? The periarticular involvement, is there soft tissue? Either it is fusiform or nodular. Nodular in rheumatoid arthritis, fusiform in psoriatic arthritis. And the calcifications, are there any calcifications or not? And if this is present, is intra-articular or not? Okay. So it is very important to manage the cases and to consider the joint. Which joint? It is uniform or non-uniform? Are there any deformity or not? Is there soft tissue swelling, periarticular swelling? It is diffuse or just focal, nodular? The calcifications and even the bone erosions is marginal or central or periarticular. It is well defined or not? It is symmetrical or asymmetrical? There are bone proliferation or not? Bone proliferation, so it is not erosive disease. It is not rheumatoid arthritis. Periarticular and overall osteoporosis. This because of the osteoporosis related to the hyperemia, and this is one of the features of rheumatoid arthritis. Vacuum phenomenon is degenerative, and subchondral osteolytic lesion, subchondral cyst is rheumatoid arthritis. This is an osteoarthritis. Okay. Here is the deformities which you can associate with some of the diseases. Swelling deformities, flexion, hyperextension of the proximal interphalangeal joint and deflection of the distal interphalangeal joint. Boutonniere deformity, flexion of the proximal, hyperextension of the distal interphalangeal joint and the flexion of the proximal interphalangeal joint, or dislocation, like here. This loss of the articulation between the articular surfaces. The joints, the diseases which are commonly associated with deformities are rheumatoid arthritis, Jacquard arthropathy, post-traumatic fever, and systemic lupus, which is very important because these are reversible, but this is irreversible, and all of this will explained in the coming lectures. The joint narrowing, no joint narrowing. You can see this, the joint is smooth, symmetrical, no narrowing. Here is smooth, symmetrical, uniform narrowing, or asymmetrical. There is narrowing here, but there is here looks fine, relatively fine, not fine, relatively fine. So this in uniform, it is rheumatoid arthritis. In non-uniform, it is osteoarthritis. So we build our diagnosis. There is is there the alignment? Is there deformity or not? There is the joint space narrowing. Is there any joint space narrowing or not? If not, what is the pattern of narrowing? It is uniform or non-uniform. Okay. So we have here the uniform. We speak about uniform. So it is rheumatoid arthritis, hemophilia, alkaptonuria here, osteoarthritis, and CBD, and they are both of them are considered related to each other. They have many features, but CBD is more different regarding the target and regarding the larger of the geocyst, subchondral cyst. Okay. The ankylosing rheumatoid arthritis associated with fibrous ankylosing. Okay, ankylosing was fibrous ankylosing, but juvenile idiopathic arthritis is bony ankylosing. Ankylosing spondylitis is there is ankylosing. You can see here sometimes in the even in the psoriatic arthritis can be ankylosing, but here it is, there is ankylosing in young patient. It is juvenile idiopathic arthritis. Okay. So if we speak about the bone erosions, the pattern of bone erosions are very important, because when it is marginal, there is difference between marginal erosions, periarticular erosions, and there is central erosions. If I describe the joint like that, here is the joint, okay? And we agree that this is the synovium, and this is the capsule. And this is just want to change the color of the. And here it is the articular cartilage covering this region. Okay. So here it is the marginal in the bare area. Okay. Here it is the periarticular is in gout. But gout also can involve center, but just this is for the example, it is mainly periarticular. Okay. And there is central erosion here with erosive arthropathy. I hope this is clear. Can you tell me this in the chat, please? So we have marginal erosion here in the bare area. We have periarticular erosions outside the joints in gout, and we have central erosions in erosive arthropathy. I hope this is fine. This is clear for you? Okay, so we have here this, there is central erosions here. Okay, there is central erosion. So this, and this is that, and this is, there is erosion here, and there is some whiskering and beguiling. Okay, and here it is, there is marginal, although, but this erosion of, it is not central erosion. There is whiskering and the hypertrophy in the margin. This is with psoriatic arthritis, and this is a normal one. Yeah. So we can see clearly here is the distal, and you can see that there is central erosion, and this is the gull wing sign. The bone destruction associated with rheumatoid arthritis, and there is also arthritis mutilans where there are multi-leveled involvement destruction of the joints. It is the neuropathic arthropathy. The target is the midfoot, especially the tarso-metatarsal joint, less frank joints, and the intertarsal joints associated with deformity and debris. So the bone destruction and the deformed bone destruction is associated neuropathic arthropathy in rheumatoid arthritis and arthritis mutilans, which is one of the variants of seronegative or seronegative arthritis. Okay, this other pattern of bone destruction, other pattern, so it's a collection for bone destruction. The periarticular and overall osteoporosis. Overall osteoporosis or regional osteoporosis, complex regional pain syndrome, if there is fracture or any problem, local problem, this can be associated with regional osteoporosis. Rheumatoid arthritis, periarticular osteoporosis, and also any inflammatory arthritis can be associated with osteoporosis because osteoporosis, the region of osteoporosis, the reason for osteoporosis is in the arthritis and the inflammation is related to the hyperemia. You can see clearly here this, and this could be the first sign of rheumatoid arthritis. You see this osteoporosis, and when you say osteoporosis, don't say only based on what something I don't like this color. It seems a bit elusive. Osteoporosis means that this is the cortex and the endosteum. This is the cortex and the endosteum. You see this, the medulla. You have to, when you gather this and this, should be more than the half of the bone width. But when you see here, gather here and here, it is very thin cortex. So this is the osteoporosis. This is the meaning of osteoporosis. Okay? So the bone production, which could be osteophytes, which marginal osteophytes, rheumatoid arthritis and CPPD and hemochromatosis, or be periostitis or periosteal, the fluffy or whiskering in psoriatic arthritis and in the psoriatic arthritis and the active arthropathy, ankylosing spondylitis, and also in some disease, inflammatory bowel disease or hyperparathyroidism. Okay?